Welcome everyone to today's discussion about the Online Master of Public Health program at the University of Michigan School of Public Health. My name is Lisa Garber. I use she, her pronouns, and I'm the program manager that works closely with our online students. Are you ready to dive into the world of public health and explore how you can make a significant impact? Then I'm thrilled to introduce a dynamic panel featuring Dr. Levin and several of our inspiring students. Lauren and Jody are here joining us today. Together, we'll discuss our online MPH in population and health sciences and the critical role it plays in shaping future public health leaders like them. Throughout our conversation, you are welcome to type questions into the chat or raise your hand and unmute if it feels like the right time. We'll also save time at the end for a full Q&A together where we can open discussion widely. Before we meet our panelists, I'd like to give you a very brief overview of the program. So this is a comprehensive 42 credit program designed to be completed in 2 years while taking just 2 courses at a time. It's completely online, making it ideal for working professionals who wish to balance their careers with their education. We're looking for passionate individuals dedicated to making a difference in public health. Our applicants come from diverse backgrounds, and this enriches our learning environment. A bachelor's degree in any field is required, and while courses like statistics and biology are helpful, there are no prerequisites. Most of our applicants do have at least a few years of work experience and a clear dedication to public health. If you're not in a related field, you might demonstrate your commitment through volunteer work, relevant coursework, or a clearly articulated vision for your future in public health. We're eager to work with people who are ready to make an impact, whatever your background. While we welcome diverse perspectives, due to external constraints, our program can currently admit only US citizens or permanent residents. If you have any questions about your eligibility, our admissions team would be happy to assist you. Now let's get started by giving each panelist a chance to introduce themselves and to share a bit about their journey to Michigan's online MPH program. Dr. Levin, can we start with you, how you joined Michigan? You're muted. You can do it.
There we go. Sorry about that. So I did both my master's of public health and my PhD in epidemiologic science at the University of Michigan. Our School of Public Health is one of the best in the country. I had a great experience here during my time as a student. I felt that the MPH program left me well prepared to join the public workforce, and then also highly competitive for postgraduate fellowship programs. I felt like I received great mentorship from my professors while I was in the program and even after I graduated. And I feel that the U of M connection is lifelong, and you can pretty much find proud U of M alumni everywhere. And so I was really excited to come back to U of M as an instructor.
Thank you, Dr. Levin. Very good to have you here. Jody, how about you? What inspired you to join us in Michigan?
Certainly. I mean, I was a USDA scientist working on poultry diseases with genetics and infectious diseases and cancer research. And I wanted to find that realm between the animal health and human health. And during COVID, we were starting some projects that looked at if you vaccinate poultry, you can decrease food insecurity and malnutrition because you're protecting the livestock, and it's a huge protein source. So I was looking for online programs, and I applied to U of M and also applied to my alma mater, South, which I will not name. And within a week of applying to U of M, I was accepted, and my alma mater, even though I defended a dissertation, wanted money to apply to the university and wanted money to apply to the program of Master of Public Health. So I didn't want to pay out-of-state tuition, and U of M's program supersedes everything and their reputation. So I went with U of M and haven't looked back.
Thanks so much. We're happy to have you here too. And Lauren, how about you?
I pretty much similar. I did a bachelor's of science, public health at Wayne State University. So in Michigan, I knew that I wanted to stay in the state of Michigan. And I was like, I always wanted to go to U of M and do the MPH program, but I didn't think it was possible with my lifestyle. Like just like working and being a mom, and there was no way that I was going to be able to drive out to Ann Arbor. And then I found out that they had an online MPH program, and I was like, I have to apply. And I'm really glad that I did. And then I did talk to a few of the epidemiologists that I work with that I am very inspired by at my job. There was and like just very smart. And there was a commonality, and it was three, and they all went to U of M School of Public Health. So I was like, okay, it seems like it prepares you to do what you need to do. And those three people are like, they're leads, they're leaders, and they probably do a lot more than they should. But it just shows like how equipped they are to do the job. And so I knew that I could see a future. I could see like that being like, I could be there if I have the right tools. And I think that this program can and does provide me with it.
Wonderful. Thank you. We're very happy to have you here as well for today's conversation. So with all of that, let's dive into our program and curriculum. Dr. Levin, can you provide an overview of some of the main components of the curriculum and how you're involved in advisement, working with the students in that space? Liz, you're muted.
How about now?
All good. We're ready for you.
Okay, so as Lisa mentioned, it's a 2-year program. And so you would start in the fall, and each like normal university semester, you guys will do 2 8-week terms. And then so in the fall, during your first 8-week term, you'll start with taking Public Health 512, which is an introduction to epidemiology for public health. And it's kind of a broad intro to the field, to study designs, to how we determine numbers of disease, rates, how we describe diseases in time and place. And I teach that class. I really enjoy it. I think it's a fun intro to the field, and all of the students take that class. And at the same time, you'll also be taking EPID 508, which studies the social determinants of health. And then during the second half of your first semester, you'll take Public Health 511, which is a nutrition course, and it looks at program evaluation, designing programs in the context of nutrition. And you'll also take a biostat course that first semester. And then in winter, you have 510, which is a public health communication course. There's a health management and policy class, some environmental health classes, and then a class in population health. And in that spring of your first year is when you can start your elective series. So this is kind of when you'll start to meet more with your faculty advisor. I'm one of the faculty advisors, so we will help you choose electives that help you fulfill your career and educational goals. So we have series offered by epidemiology. So I teach those courses. There's EPID 590, which is Epid Methods course. And then there's Epidemiology 602, which looks at data analysis in public health. There's environmental health sciences courses. There's a health behavior, health equity track, a health management and policy track. So you can take a complete track and then do another track. You can do classes here and there. So that's really about tailoring the program to you and meeting your interests. And then during year 2, you'll continue with your electives in the fall. And that's where you start your experiential learning. So we have 2 classes. This is Public Health 680 and Public Health 681. And so the Public Health 680 takes place during the fall semester of your 2nd year. And during that time, you'll partner with an external agency. We have lots of placements for students. Sometimes students will find their own placements, or they do a placement where they're currently working. And your goal is to develop 2 deliverable projects. They may be data analysis, it might be a fact sheet, or a social media campaign for a health issue. It's really broad what you can do. And again, we want you to partner with agencies or work on projects that are taking you towards your own career goals. And then in your spring semester of year 2, you'll continue on. You'll do what's called an integrated learning experience. And this is where you develop your own project. And then you'll have the ILE paper, which is meant to have you showcase the different competencies that you've learned through your coursework in the program, and demonstrate that in some project of your own design. It might be a research project, it might be a grant proposal. Some students do health needs assessments, policy briefs. So there's all sorts of different projects that you can decide to work on for that experience. And then you will finish the program at the end of the summer of year 2. So you'll graduate that spring and then still have to complete a class or 2 over that final summer.
Perfect. Thanks for that great overview. Jody, Lauren, tell us a little bit about your experiences with the curriculum. I'm curious to know if you have some aha moments, something memorable that you had during your studies. Or Lauren, I know that you're working on some projects already in the applied practice experience and that are highly related to your career. I'll let both of you tackle those questions. Lauren, do you want to go first?
Yeah, sorry, I was getting my mouse.
That's okay.
Yeah, so I'll start with the Apex project. I think that concept is really cool. I'm doing it through my work, so it's relevant to my work. And so I'm doing 2 projects. One of them is a training to disseminate 2 programs that we work with across the state. I work at the state health department in Michigan. And then the other one is we're implementing a different program in the unit that I work in statewide. So you can imagine, and it's nothing that's been introduced in Michigan. So there's a lot of like footwork that needs to be done. And so I'm creating like a 1-pager, but it's really a 2-pager of something that can be disseminated like on our website or to 2 different audiences about that program. But I think that one of the aha moments for me was with all the like the epidemiology classes. I chose to do my 1 elective in epidemiology, but even just like the core classes of epidemiology and biostatistics is we at my work had to do a gap analysis recently, and we had to look across the entire state to see where there was high rates of hepatitis C, and then how that coincides with just like services that are available. And that was very like direct to what I've learned, because we were able to like calculate incidence rates, and we were able to do these calculations that I had learned, but like actually use them in practice. And there's been a few times where I've had the opportunity to be able to do that and work with some of our epidemiologists on some recent reports. And I think that was my aha moment, where I was kind of like very, I want to say like intimidated by the work, because it just seemed so quantitative to me, where I feel like my lens is like naturally very like qualitative. And it wasn't like daunting. It was like, oh, I know how to do this, and I can understand everything that's being sent my way. And it's because of, this program. So I think that was like one of my aha moments that I had.
Wonderful. I think we hear that fairly often. People are a little bit intimidated by some of the quant work that they have to do, either in work or, as you're starting intro to biostatistics and principles of epidemiology. And, our faculty like Dr. Levin here really help you get through it. And it's great that you can apply it so immediately at work. Jody, do you have any comments on your courses? Anything that's been particularly memorable for you?
I just started the Public Health AmeriCorps as a member, and last week was my first week, or kind of partial week, and it's with the Lansing School District, and the program called FORT, which is Families Overcoming Rough Times, where they are helping homeless families with everything they need, clothing and school supplies and everything, and transportation to school, so that they can succeed and go to school and be productive at school. So one of their professional development programs was on motivational interviewing. And it's like there's a whole class or whole 8 weeks in the health, behavior, health, equity program, or the certificate. And it's like, wow, I mean, the Lansing school districts are using this, and it's an application of what we're learning in public health, which was really exciting. Of course, he gave a condensed version in 5 hours, but
Fair,
so
fair. A lot of things that we do is quite condensed, but still very impactful and robust. Thank you. So let's shift over to career outcomes for now. Dr. Levin, could you tell us a little bit about the career paths that our graduates typically follow and the support systems in place to help them succeed?
Sure, absolutely, Lisa. So our career teams and our faculty and program manager, Lisa, they all play a large role in helping our students succeed. And I feel like our team is very dedicated to helping our students succeed. So the career team specifically, they're there to support you from the very beginning. They can do everything from helping you with your resume to helping you explore different careers, or do job searches. They can even help you negotiate offers when they come in. I actually, when I was a student, used them quite a bit. They were really helpful in making my CV. So, and then to give you an idea of how our graduates are doing and what they're doing. So 93% of our graduates are either employed or pursuing further education. And every single one of them reported that they were satisfied with their role. So they've landed positions at top organizations like Blue Cross Blue Shield of Michigan, the Centers for Disease Control and Prevention, CVS Health, Deloitte Consulting, Michigan Medicine, Henry Ford Health System. And also we have lots of students that work at the University of Michigan or Michigan Medicine in various capacities, some doing research, some working in other programs. We just heard back recently from a couple of our students who just reported that they got their dream jobs, which is really exciting and rewarding for us to hear. So Sophie Loeb from the class of 2022 started out teaching and in public defense. She's now a policy analyst at the Center for Progressive Reform, working on critical public health and policy issues. She's particularly involved in tackling social determinants of health through legislative and advocacy efforts. So I'm very excited for her. And Shayla Zimmerman from the class of 2023 has shifted from a role in community impact at United Way. And now she's in her dream position as a program officer at the Institute for Sustainable Communities. So she's now supporting climate justice and the EPA's Environmental Justice Thriving Communities initiative. So it's really exciting and really rewarding for us to know that our students are going out, getting jobs, they're highly satisfied with their jobs, they're feeling prepared, they're getting dream jobs. So I feel like U of M, this program offers great support in terms of finding jobs. I'm sure Lauren and Jody might have more to discuss about maybe their use with these or.
Yeah, definitely. Thanks for that overview. It was so fun to hear from Sophie in particular about that, because she attached her policy brief that she just wrote. Like one of the
It's so
first things that she
exciting.
did in that dream role, she wrote a big policy brief, and a local NPR station picked it up and has been talking to her about it. So we're gonna hear
Oh,
on the
that's
radio
great.
soon. Such
I
a
love it.
fun story developing over there. So, but yeah, definitely. Let's hear from our students. Lauren, can you tell us a little bit about how the program's been helping you in your career progression?
Yeah, well, I feel like maybe I went into that already too soon, but there's definitely been skill sets that have helped me like in my career that I currently am in. And I think there's just a lot of opportunity to like network in that way for career building. And I mean, I know LinkedIn, like there's just a lot of different things. This program pointed me towards a scholarship, and I received that scholarship, and that was really, really, really helpful for obviously to be able to do this program. And through that, like I've been able to network with people and meet people in similar career fields, but like different. I've met a few people in like doing like an MD and an MPH. And I think the other thing too is like this cohort, like your cohort is your cohort and it's very close, and you get to know each other. And so I've been able to meet people in the cohort like that are on a federal level and doing things on that level and kind of getting like an eye into like, do you like what you do and what does that look like and what does your day-to-day look like, and things that like I probably wouldn't be able to have those opportunities to just like ask people unless I like actively sought it out. And here like in the program, because the other thing too is in the program, it's online, so there's people that don't reside in Michigan and are working in different states. And it's really awesome to be able to kind of just side chat or like compare like what their state is doing to what we're doing, and like, look at program models and things. So there's a lot of passion, and I think that's like really helpful when it comes to like networking and career building.
Thanks for that. What do you think, Jody? How's it been working out for you?
Since I'm starting a second career, I didn't have many connections in public health, and I've used the portal extensively to find those connections. And I didn't really have an idea or a sponsorship for an Apex project, so I used the portal to find and apply for the projects for the Apex, and that's been really, really, really helpful. So And I mean, with Lauren, we have individuals in our cohort that are from all over the US, all 50 states. There's even one in Hawaii. So, I mean, so you get that different perspective. People are in industry, or they're in public health already, or they're with the government, the CDC, and it's all this different perspective from all of your cohorts and different professionals in your cohorts. So you learn quite a bit from.
I'm glad that you both mentioned that. It's definitely something that we work on specifically within our admissions and our recruitment. We want to bring in lots of different perspectives, and it really enriches the classroom discussions and your overall network. And so I'm glad that that's working out. So that's probably a good segue. Why don't we talk a little bit more about just the overall experience in the program? We've talked a little bit about how we're connecting with peers and doing some networking and accessing the careers portal and looking for jobs and all of that, which is wonderful. How is it just fitting in with your busy life? Jody, you've got a lot going on at home. Lauren, you do too. How do you balance these priorities along with your coursework?
So we retired, started a new career, and I have 3 children. So 2 are in college, one's a freshman and one's a junior, and then I have a child with a disability. So he's in high school right now. And I was working full time and closing out a facility. So but with the online program, I mean, you can do it. The classes are in the evening. I've never really felt that I didn't know my classmates, even if we're online, because we have Zoom sessions and we talk with each other. So like if you're doing a joint project and stuff, writing paper, we'll schedule Zoom classes and stuff like that. Quarter systems, I'm used to quarter systems. So actually I kind of like quarter systems because then I don't get lazy. And with quarter systems, you have to be on it every day, or look at it every day and do something every day, because if you don't, you can get behind. And every week you have assignments due. So, but you don't get bored of the class because it's only 8 weeks. So, but the online program does fit in with your schedules. So, and the classes are usually the same day of the week, typically. So you can, it's like 2 days of the week that the online classes are. So.
How about you, Lauren? How's it working out for you?
Yeah, I love working online and doing online schooling, because the fact that you can work at your own pace, like you have like a window, each week to get things done. But you can come back to the lectures at any time. I think that's really, really helpful, to be able to just have that there at all times. And I utilize it. I take screenshots and I put them in my little notes app, and like as far as like implementing this in my life, it works well. I had mentioned earlier that I'm a mom to a 14-year-old at a pretty rigorous high school, I would say. And so that takes up a lot of time too. And so like making sure that prioritizing his education along with my education. And then I work, like most of us, which I forgot to mention in that last question, is most people, I think everybody in our cohort is a working professional. And so it's nice to be able to have that like commonality and like be like, oh, we're in this together and we're doing this. And that helps me like to be able to get this done and to get motivated. As far as like the layout of I'll say this, I found my groove. So like I am able to get my assignments basically done for my goal is like I want to have my weekends. Like, I want to be able to do the things that I love, so that way I can like show up for the things that I need to do and that I also love, right? So like I've kind of been able to work it, through this course where I'm far enough now to like, I understand, how I work well and when I study well and this and that, to where I can get most of it done and then come back to it like at the very end of the week after I've done a few things, or at the end of the weekend, so, and then turn everything in on Monday. So, it's that there's consistency, and I like that. For the like most part, most of the classes are on the same days each week, and it's the same like process of turning things in. I feel like the professors work together with that to kind of be cohesive, or the program does, and it's noticeable and it's really helpful. So, yeah, it has not been an issue for me to fit this in. And I think it fits in really, really well, actually.
I love to hear that. Does that track, Dr. Levin, your faculty advisor for 99 students at this point in time? Is that what you're hearing across the cohorts and in class?
Yeah, I think that's kind of one of the unique things about this program is we have students all over the country. Last semester I had a student in Japan, another one in Saudi Arabia, so we're all in different time zones. You'll see my children nightly on camera as I say goodnight to them. I see other people's families. I've said hello to people's cats. I think it's kind of an intimate setting because we're in each other's living rooms, and life kind of goes on even while we're in class. Some students might have to break for a second to take care of something, or I might be in a meeting kind of late at night so that it's early in the morning for my student in Japan. So I think there is a lot of flexibility with this program in terms of faculty being willing to meet when it works for you. As Lauren mentioned, the classes are at night. A lot of our students are working full time during the day. So it really offers up a lot of flexibility. Even when you're traveling, you can still join from wherever you are. The fact that most assignments, if not all of them, are done asynchronously. So you're doing it when it works for you. So Lauren mentioned that she likes to get things done during the week so she can just be a normal person on the weekend and do the things she enjoys. And so I think that it really works for a lot of people. We've got also some students due to some chronic illness issues that the online program works for them because it's so flexible. Oftentimes, if you are able to talk to the professors, some deadlines can be extended to meet certain needs of students. Our Students with Disabilities Center does lots of things for students that may need extra test taking time or flexibility around assignments, and everybody's very accommodating for that because we all want you to succeed, and we're aware that you have other things in your life besides being a student. So I think we really try to accommodate that in this program.
Yeah, I think that's definitely one of the things that we work hard on, at least on the administrative side of things, to make all of those things flow nicely for everyone. And it makes me think, how does this all work when you do need access to resources, when you need access to a faculty member, with things being fairly asynchronous? You do have live class sessions, but are the faculty there when you need them? Can you get connected to the services that you need when you need them? Open floor.
Yeah, I'll start. Yeah, I've never had a problem. We use an app, Slack, so we use Slack. I have it on my phone and my computer, so I can just like keep up with what's going on. And most of our professors use that too. So if there's like a question on homework, we can just type it in there, and if they don't answer it, like the class, somebody will. And I don't think I've ever actually had a professor that doesn't answer it though. But it's nice because we get to learn together. So usually somebody has the same question. And then it's nice too because there's different channels. So there's like different things that are going on, or opportunities on that app that you can just kind of easily access. Office hours are great. And they're available every week, unless it's like something's going on for like a holiday or something. But I've emailed, I've used office hours, I've used Slack. I think Slack is my favorite form of communication just because it's very like casual, and you can kind of get like a lot more input. But yeah, I mean, it's challenging. Like the courses are challenging. I think they're challenging. But it's never like I've never had that feeling that like I'm not supported or that I'm not going to get through it. And I've had that feeling before in school where I'm like, I don't know how I'm going to make it through the semester with this course load. And I don't feel like that. And I feel very like supported, but also not just like supported like outside of class. I feel like the class lectures, you get everything that you need in the lecture. So yeah.
So along those lines, the courses are challenging, but you're getting what you need. Do either of you feel like you had to have a wealth of knowledge in a specific area before starting the program? We tend to see applicants from really wide undergraduate ranges, right? So we see communications and English and biology, the whole gamut that you could imagine. Do you feel like you needed anything specific to start the program and do well in class?
Everything was pretty well provided with the class lectures and stuff. I mean, having some areas, I have with the science background, I did more, had more experience in the epidemiology and other, environmental sciences. But then in the public health realm, I didn't have any experience in the policy and evaluation. And, the professors in the video lectures, which like Laura and I rewind and review quite a few times. It's nice having the video lectures taped and stuff, but the information has been provided. So
Yeah, I feel like it's hard for me to answer that because I did public health as my undergrad. But it's foundational, like the skill sets that I've needed to like do this work in the course. There's nothing that I haven't learned that week, or that, whatever it is that I need to do the homework or the project or the policy brief. That was a really interesting class, I think, was writing that policy brief. And I think that's probably a skill set that we could take in a lot of different careers, is just learning technical writing and learning it the correct way. So I think there's a lot of room for like transferable skills too.
difficult to write a policy brief with only 6 pages. I mean, but you have to learn that skill set. I mean, because you have page limits and policy briefs and grant funding, which is really helpful.
So glad to hear it. I feel like sometimes we hear, I can't get this condensed enough, or, oh my gosh, I'm looking at 15 to 20 pages. This feels like a really, really large assignment. And by the time you get into the work, it ends up being the right volume, right? So we're reaching a point where I think We've provided quite a bit of information for you all, our attendees. We'd like to open up the floor for questions. Where would you like to spend our time? We've got about 15 minutes left in our hour. I'd like to really get through the burning questions that you all have, make sure that you have time to communicate with these students. And faculty. I see one question in there about language proficiency exams. So if you are not a native English speaker, there are ways that you can demonstrate English proficiency. You mentioned that you have some graduate degrees that are already done in English, you have transcripts from those. That might be what we need to see to demonstrate English proficiency. Our admissions team will have to verify that, so I'd recommend just sending in the name of your institution. I can put my contact information and our admissions team in the chat for you. But if that's not the exemption or the demonstration of English proficiency that's needed, next would be a TOEFL exam or an IELTS exam. What other questions do we have?
Feel free to use the chat or unmute yourself.
I'll go with one of the top questions that we get at this point in time to start things moving. Oh, wonderful. Can we talk about any scholarship resources that are available? I might take that one. I'm one of the reviewers for scholarships, and so the first source of funding for this would probably be the School of Public Health Scholarship. So when you submit your application for consideration for admission, we'll also review it at that time for scholarship. What we're looking for is kind of a mix of academic merit, commitment to public health, enthusiasm for joining the cohort, unique perspectives that you're bringing to the cohort. No one thing is really going to make or break it in that area. Unfortunately, it's really just about your whole package, what you're bringing. Those scholarships tend to be, they're about 25% of tuition. So most recently they were $12,000 total, divided up across the 2-year program, ends up covering about 25% of the total cost of the program. So if you want to be considered for one of those, I highly recommend applying by our priority deadline, which is February 15. That's the point at which we really start issuing those scholarships, and we will continue to do so until funds run out. So the closer you are in that priority deadline space, the greater chance you have at being considered for one of those scholarships or being in the pot when we still have funds available. Other scholarships would be oftentimes our students will submit the FAFSA, the free application for federal student aid. So that's something that you should do early in the process. If you're thinking about starting a graduate program, they like to see those in the spring, I think, or as early as March. You can submit it all year long, but the earlier the better for FAFSA consideration as well. That tends to produce student loans. Lauren, I know you mentioned your scholarship earlier that you secured. Do you want to talk a little bit about that program?
Yeah, it's the CEW Plus. So it's for empowers women and underserved individuals at the University of Michigan. And yeah, so I applied for that, and I had to fill out an application and read an essay, but that was really helpful. So that covered well, it's split up into 2 semesters. So it would have covered a full-time semester, but it split up into 2. So that was really, really helpful. And unbeknownst to me, when I applied, I didn't know this was like a very big program at U of M. But they, there's been a lot of opportunities from just that scholarship alone, like networking opportunities, events, football tickets. I still haven't got mine yet, but whenever there's like free tickets and they have them that donate, you get an email, and if you're not doing anything and you can respond in 1 minute, you might be able to get them. But no, there's just been some really cool things through that. And that was actually through Lisa, through the Slack application. I had reached out and I was like, hey, wondering if there's any financial opportunities that you know of. And she supplied that information. So it's out there. There is a lot out there.
Yeah, that's a good point, Lauren. So when I see questions like that on Slack, we usually talk about your unique situation, what you're looking for, and if there are opportunities that are relevant, I like to pass them on either because you made the question or I just put them in the Slack channel for everyone to consider because the deadline's coming up. Depends on how broad I think an application would be. So at the graduate level, oftentimes you're looking for individual sources of funding like that, where, the main school is considered at time of application, the FAFSA is around the time of application as well. And then beyond that, you're looking into independent organizations like CEW Plus or external organizations too. But those all are very specific to what your story is.
Yeah, and I would add to, just to clarify, that I did late enrollment. So I would have took advantage of those other things, but that was me. I was late on the ball on that.
That's a good point, Lauren. So that kind of brings up the priority deadline, right? Like the earlier you apply, the more time you have to look at all of these different sources. And so we take applications much, much later than that. We welcome them. Oftentimes students are, it's getting to be summer and thinking fall would be a great time to start a program. We definitely not going to turn away your application for that. We'll take applications into June for the fall start, but sometimes then you have to get a little creative in where you're looking for your funding. Oftentimes our students in that type of situation will have employer contributions or military funding, other sources of funds that are available as well based on their unique situations. I see a question here about whether students have taken more than 2 classes each semester. Dr. Levin, have you seen experiences like that? I can.
If you're taking a class in another department, I don't know that there are more than 2 offered where they wouldn't overlap.
Yeah, that's a good point.
Um,
So the way the curriculum works for that first year, there are only 2 of the core required courses offered at a time. So when you start in the fall, epidemiology and social determinants of health are taught for the first 8 weeks of fall, and that's it. And then the second week of fall, nutrition and biostats are taught for those last 8 weeks, and that's it. So there wouldn't be an opportunity to take an additional class at that time within the pop health curriculum. And then
the classes move at warp speed, so I don't know if Lauren and Jody, if you would ever wish that you could take another class or you're feeling pretty busy with 2.
Yeah, and it's 2 8-week classes and then 2 more 8-week classes. So it seems it's pretty full. We're pretty fulfilled.
You're taking like 4 per semesters, 2 per 8 weeks. It's pretty intense because the epidemiology and biostats are pretty homework intensive, and then policy was quite intensive, and social determinants of health was quite, yeah. So I don't think I could have fit in another class in full-time.
Yeah, that's fair. I think especially in that first year, everything is lockstep prescribed. Once you get into electives, I've seen students maybe get a little bit creative there because spring term, when you take your first elective, that time you get to take just one course. So if you're taking the epidemiology track, you take Evid 590, and that's the only thing running at that time for you. So you could get creative and look for another elective that happens to be running in those couple of weeks. I usually work really closely with students if they're looking to do something like that. And usually it's because they're really excited about two specific types of courses, like the course content in each, and they really want to do both, can't make a decision between the two. Definitely couldn't give one of them up, and so they'll commit to those two at the same time. As long as the live class sessions don't conflict, like one of those happens on a Tuesday and one happens on a Wednesday, it's okay with us. But that's also about the only time you have breathing room to do that kind of thing.
Yeah. And I have had students do that where they wanted to take the environmental health class and the epidemiology class, and
How'd they do?
but it's intense.
Fair. Could you speak a little bit about the synchronous, asynchronous timing? Like how much of this is asynchronous? When do we come to class? What's a week look like?
Sure, you wanting me to take that, or Lauren or Jody?
Go ahead, Liz.
Sure. So each week, my classes, I'm assuming they're all set up like that. There's 8 weeks of class, so there's maybe weeks 1, 2, 3 would have new material. You maybe would have a midterm week 4, then 5, 6, and 7 would have new material, and then a final week 8, and then each class will have its lecture videos that you can watch asynchronously. There might be quiz or assignment, and all of those things are asynchronous. You do them when they want, or sorry, when you want, as long as you turn them in by the deadline. Each class meets once a week synchronously. I think all classes, Lisa, correct me if I'm wrong, start at 7
Yeah.
and go to either 8 or 8:30.
Yeah.
And
never on a Friday.
yeah, I think they're usually Monday, Tuesday, Wednesday.
Yeah, sometimes Thursdays.
Okay,
Only
so
two-
some go Thursday.
2 of those.
Okay.
Right.
And as far as I know, in all of the classes, attendance at those Zoom sessions, the weekly Zoom sessions, that's expected. I mean, we understand things come up, but a class really only meets 7 or 8 times, and it's expected that you're there each of those times. I teach more of the quantitative classes, and we'll be working on problems together in class. You might be working in small groups during that class time, or having individual sessions with the instructor during that class time. So if you are taking a class, I would put all of those Zoom sessions on your calendar and expect to be there.
That's good encouragement. We of course we record them for those times that something comes up, right? But it's kind of a hallmark of the program too, to have access to faculty during that time and access to your peers and be able to talk through the hard problems. Let's see. So do you think, Jody, Lauren, do you think there's anything else that you've had to try to schedule in? If you're looking at your week, you've got class Tuesdays at 7 and Wednesdays at 7. Are there any other kinds of things that you try to get on your schedule where you're meeting live with people at a certain time? And is it flexible?
Go ahead, Jody.
You know, there's times when you do a group project. I think there's several times that we have a group project, or you'll have a group paper. So then you schedule with your group when to be to discuss your paper, go through your paper. But we do that all through like Google Docs and stuff, and so we can share what we're working on it. I haven't had just scheduling with other classmates on times to do the papers, and there is a couple cohorts that are in Washington DC area, so they'll ask to you can ask to be in a group, so they've had requested to be in a group because they work well together. There's several that are in California, so since they're in different time zone, they've asked to be in area or with a cohort that are in the same time zone. So the professors have been really accommodating with that.
Yeah, There's been a few times in the Slack communication where there's been some classes like that were more quantitative and like working on problems together. So we would like meet, we would find a time to meet over the weekend or at some point like outside of class, whoever wanted to. And it was usually just like a small group, but we could kind of like walk through these things together. And a few like coding assignments, same thing. And that was like all optional. It was just like, hey, if anybody wants to meet, this is the link. The only other time that I can think of is like when you get to around your electives, and they offer, I'm sure there's a formal name, but like a sneak preview, like you can talk to the professor about that certain elective track and what that looks like. And that was like extremely helpful for me to figure out, because I was like analysis paralysis, like I don't want to make the wrong decision, you know. And so going to that and kind of like seeing the curriculum and like the course and like what are the outcomes of this elective track, because it's it's 11 credits, so you want to, you know, you want to make sure that you are enjoying it. And so that was helpful to get that little like preview beforehand, and that was like an hour I think total, but you could hop on hop off, you know, at any time.
Perfect. Yeah, that's a good final thought there, that we offer advising. You can meet with faculty, you can meet with staff. We pick times to do those as a group, and you can always do it one-on-one on your own schedule too. So that's all the time we have for today. I want to thank our panelists for all of their insights. I want to thank you all for your wonderful questions. I'll wrap up to just summarize that the MPH program is offering a comprehensive 42 credit curriculum designed for impact, flexible learning for working professionals, and extensive support for career development. We're accepting applications right now for fall 2025 with that priority deadline of February 15. We are going to send a follow-up email with all of these details, and you can reply to it with any further questions that you have. Thank you all for joining us, and we hope to see your application soon.
Thank you. Bye-bye. Have a good evening.
Everyone.
Bye, everyone. Thanks for joining us.